My digestive disease is lactose intolerance. Lactose intolerance is the inability to digest sugars and dairy products. Lactose intolerance is also called malabsorption. Lactose intolerance is harmless but can be uncomfortable. Lactose intolerance is caused by your small intestine not producing enough lactase to break down the sugars in dairy products. It is also, most people that are lactose intolerant can still manage it without giving up all dairy foods. I am also lactose intolerant, and a lot of the time, as well as I know other people that are lactose intolerant, they just fight through it and deal with the symptoms of it. But there's also pills that people take to lessen the effects of lactose intolerance. Symptoms of lactose intolerance begin usually 30 minutes to 2 hours after eating or drinking foods with lactose in them. And the common symptoms of lactose intolerance include diarrhea, nausea, vomiting, stomach cramps, bloating, and gas. Tests for lactose intolerance include drinking a lactose solution and a blood sample. The blood gets tested to see how much glucose it contains, and if you're lactose intolerant, the blood sugar levels will rise slowly or not at all. There is no treatment for lactose intolerance. It is non-curable, but like I said earlier, there is medication that can help lessen the symptoms, but not get rid of them completely. Ways to prevent lactose intolerance is changing your diet and removing products containing lactose out of your diet, and instead you can introduce lactose-free dairy products, and those are becoming more and more common nowadays. There is also different levels of lactose intolerance. So there's primary lactose intolerance, which is what most people have. It's where you start life producing enough lactase, but as children, our milk starts to get replaced by other food, causing the amount of lactase produced to drop in your body. And it falls off strongly when in adulthood, making dairy products difficult to digest. Then there's secondary lactose intolerance. It's when the small intestine decreases lactase production after an illness, injury, or surgery involving your small intestine. Common diseases that cause secondary lactose intolerance are intestinal infection, celiac disease, bacterial overgrowth, and Crohn's disease. And the treatment for it that might restore lactose levels, but it can take time. And then there's developmental lactose intolerance, which is possible but rare for babies to be born with lactose intolerance. And it's passed through genetics, um, meaning that both parents must pass on the same variant of it for the child to also be lactose intolerant on birth. And premature infants can also have lactose intolerance. And the risk factors is that you're more prone to lactose intolerance is increasing age, ethnicity, premature birth, diseases affecting small intestine, and certain cancer treatments.